You have to stop the irritation. The arch of the foot gets inflamed and irritated, and it goes on and on. So the first and most important treatment is to reduce this irritation. This is patient education, and this is some therapist pain management techniques. That's what we have to talk about here today. The key here is first to reduce the irritation. The second key is pain-free exercise. Start with the self-stretch of the arch, including the big toe into extension. I have 4 sections: diagnosis, education, pain management, and then exercise. The first section, diagnosis of plantar fasciitis. Patient history is usually an onset is gradual. It's an overuse injury, pain with prolonged standing and walking. Patient will complain about arch pain, usually the medial aspect of the heel where the plantar fascia inserts. Pain is usually worse first few steps in the morning or after they've been sitting for a while and they get up. Usually one foot is worse than the other. Usually prior physio has been ineffective. Orthotics may or may not have helped them, and they probably have a standing and walking job. On examination, there's going to be local arch tenderness, positive windlass test, that's pain with the passive dorsiflexion and big toe extension, and an antalgic gait. Expect general foot and ankle calf tightness. Otherwise, range of motion is within functional limits, strength is within functional limits. Don't expect redness or swelling or paresthesias. The second section here is to educate to reduce the irritation. This is the key. Empower the patient to protect the affected area from further irritation and overuse. Avoidance. Identify aggravating activities. For example, if running is irritating, try fast walking or biking or swimming. If prolonged standing is irritating, try a soft anti-fatigue mat or shoe inserts. We'll talk about those in a minute. Or just taking breaks. I know it's easy to say. Avoidance is the number one way to reduce this irritation. Everything else is icing on the cake. A couple of other things to talk about to the patient. Shoes. A trial of rigid shoes progressing to regular shoes as symptoms abate. A rigid shoe will reduce that stress through the arch of the foot. Start with a rigid shoe or boot. Get comfortable. Get some standing and walking going. Last year I had plantar fasciitis. I wore rigid shoes for about 8 months. Progress from the rigid shoe to a normal shoe, from normal shoes to flip-flops and slippers, and then go back barefoot. Try wearing these lighter, more flexible shoes 1 or 2 hours a day until you get used to it. Be gentle with yourself. Talk to the patient about night splints. Night splints put a low-load, long-duration tension through that arch and big toe, so that first few moments in the morning aren't so aggravating. There's 3 options for night splints. One is to do it yourself. This sock does a gentle stretch of the arch and big toe. Second idea is that you can buy something cheap. It's a cloth ankle device. The third idea is to buy something more expensive, a plastic boot-like device. We also need to talk to the patient about an optimistic mindset for recovery. I've never treated a robot, and all my patients have been humans so far, but humans need to buy into their treatment program. If the patient doesn't buy into your treatment program, if they don't think it's going to help them, it won't work. Acknowledge that this can be a frustrating journey. It's a discouraging yo-yo path over months and months. Celebrate the little wins. Focus on the gradual progress for long-term pain-free success. Encourage positive self-talk and gratitude. For example, the low-impact lifestyle may be actually better for all the joints. Educate the patient to take care of themselves. Avoid passive treatments. Encourage active participation. One of my other videos talks about active versus passive treatments. The third section is pain management. Pain management the patient can do and pain management the therapist does. Patient pain management is empowering the patient. What can the patient do to take care of themselves outside the clinic? There are 3 patient pain management elements. The first patient pain management element is ice and rest. Ice and rest are the most important. Use ice as little as you need to. Put the ice on the floor so that you can put the whole foot on it, and use a layer or 2 of towel if it's too cold. Some controversy about using ice. Too much ice may actually slow down the healing process, but when things really hurt, it's the best we've got. Yes, I know everyone recommends the water bottle from the freezer to roll your foot on it, but this only gives a spot of cooling, whereas where the water bottle hits you, and my flat ice pack on the floor does the entire foot. I think it's better. Also, the water bottle has that massaging effect, so let's talk about that. The second patient pain management element is this self-applied soft tissue work. There are many rationales and many techniques. They're supposed to address the fascia or the trigger points or promote blood flow, whatever. This all has to be pain-free. We just talked about reducing the irritation. The one I recommend, the one I start with, is a self-stretch of the plantar arch and the big toe into extension. Just like the windlass test, it has to be pain-free 10 times every hour. There are some alternatives, but the results are variable. Some people love this and some people hate it. Remember my rule, pain-free. So I'm talking about cross-friction massage by hand or plantar fascia massage by rolling on a ball or that water bottle. The third patient pain management element is arch support. This is also the compression idea from First Aid RICE. Remember the jingle, rest, ice, compression, elevation? This is the compression. 3 options for the patient arch support. First option for arch support is to try do-it-yourself cardboard inserts. Ask Google for do-it-yourself cardboard shoe insoles. I found this slide. You trace your foot, you cut out the cardboard, you put it in a shoe, you add medial arch support. I've done this, and yes, you do have to do some trial and error, but it's very cheap. Let me know if you want me to do a video on making your own cardboard orthotics. The second option for arch support is to something cheap over the counter, a full-length cushiony insert. The third option for arch support the patient can do is a self-applied hockey tape or athletic tape. I don't think you really need this fancy stretchy tape, but they do have a nice video on how to apply the tape. We'll talk about some custom orthotics in a minute. Relax, dude, I'll get there. There are 3 therapist pain management elements. This is passive modalities, this is manual therapy, and this is custom orthotics. I told you I'd get to orthotics. I didn't forget. The first therapist pain management element is any passive modality that resonates with the patient. Yes, this is the placebo effect. Yes, my video on active treatments are more effective than passive treatments, but for a pain patient, you need options. As long as it's not contraindicated, go for it. For example, ultrasound, laser, TENS, use that treatment time as one-on-one education with the patient. Beware that some clinics upsell special new modalities like shockwave, and I'll talk about shockwave in a minute. The second therapist pain management element is manual therapy. I mean local tissue massage and joint mobilizations, especially the subtalar joint. That seems to be the magic spot for a lot of people. There are different techniques and different reasons. Results vary. Please don't make your patient worse. The third therapist pain management element is custom orthotics. I would also include taping in here. I know athletic trainers love their taping, but taping is temporary and it really depends on the person doing the application. Custom orthotics can be expensive for the patient, and I know some clinics upsell expensive custom orthotics and make lots of money. But the effectiveness of orthotics for the patient is inconclusive. The biggest advocates for orthotics are the people who want your money. So buyer beware. There's some things I left out. What I did not include: anti-inflammatory medication. That advice comes from the doctor or the pharmacist. I'm not going to talk about injections or surgery. Again, that comes from the physician. Elevation of the foot to reduce swelling. This is part of that First Aid RICE jingle. Remember, rest, ice, compression, elevation. Some feet are quite involved, and this is an option, but usually not. Contrast baths for blood flow. But this yields questionable results. My rule of thumb is that if it's inflamed, use something cold. If it's stiff, use something warm. Shockwave is the other treatment recommended for plantar fasciitis. It's been in the physio world since like 2010, 2020. If other conservative treatment has failed, if the plantar fasciitis is chronic, then I'd consider shockwave. But remember, shockwave can be irritating in its application and not every patient can tolerate it. The fourth section here is to introduce recovery of motion and strength and balance and mobility. That's the exercise part, but only if the patient is feeling better. Remember my 3 categories for treatment: for pain, for range of motion, and for strength. Always start with pain management. As symptoms go down, then you can progress to recovering the motion, then you can progress to strength, balance, and mobility. That was this other video I did. Gradually load the tissues. Remember I keep saying pain-free exercises. For the foot, we also need to talk about reintroducing weight acceptance. This is like you would progress an ankle fracture from being non-weight bearing to partial weight bearing to weight bearing as tolerated. So part of this is the shoe. We already talked about starting with a rigid shoe to reduce that irritation through the arch. That was this picture. So now we can move on to talk about exercises, pain-free exercises. If you have access to a pool, walking in waist-deep water is another way to reintroduce weight acceptance and balance exercises. Usually physios start with some table exercises and then progress to recovery of motion and then mobility and strength. So a sample program would look something like this. Start with the arch self-stretch exercise that we talked about in the pain management section. Remember that? Remember this? So add long arc quads with ankle pump. Add a belt stretch into dorsiflexion, including the big toe extension. Progress to seated ankle pumps. Progress to a wall lunge stretch, both sides. Add mini squats and calf raises. Progress to single leg balance forward reaching. Walk on heels. Walk on toes. And these pictures are from my book. You didn't think I wouldn't flog my book, did you? What did I miss? Well, there's a couple things I didn't mention on purpose. Eccentric loading is not easy for most patients. This was popular in the 90s and the 2000s, but not everyone is still excited by it. Resistance bands are popular in physio. For plantar fasciitis, this is a pain patient, so get them out of pain. Then it's gentle motion, then it's mobility and balance. You don't really need the bands. You need pain-free, closed kinetic chain, stability and balance. Get up and get moving. And no towel scrunches. Calf raises are a better way to work on the foot and calf muscles. That's according to Basmagian. Remember, the key takeaway here is that plantar fasciitis is an overuse injury and these are pain patients. The first thing to do is to reduce that irritation. If you're only doing one exercise, it's this pain-free self-stretch of the arch and with the big toe going into extension. Do you have any plantar fasciitis tips and tricks? Let us know in the comments below. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. It's time for another video, and this one will make you smile and unlock a world of timely updates by subscribing to my channel. Thank you.